Hi, I'm Dr. Aditya. You all have seen me on this platform several times, either in the form of someone who's giving you some clinical masterclass on some surgery that I'm doing, or in the form of guidelines that I'm reviewing every week, or be it in the form of OBGYN nuggets or features of the day. But today, I'm not here to be doing any of these. Today, I'm here to do two things. The first of which is to thank everyone over here who has put their faith on us. We complete 2 months on the 2nd of June, and I can say that the response has been overwhelming. It's been tremendous. We thank you all for that. Second, on the occasion of our completion of 2 months, we shall be starting a new segment, CRISP OG. CRISP, it stands for Conceptual Residency Intensive Skills Program, OG, Obstetrics and Gynaecology. Well, if you're going to be talking about OG, if you're just going to be opening up any English dictionary, they will say that it's a slang for original gangster. But the other meaning of it is someone who's extraordinary in their field. That is exactly the intention that we harbor over here. We wish to make everyone over here an extraordinary person in obstetrics and gynecology, the OG in OG. So, what is so special about this segment? We already had a couple of months of live lectures. There are several differences. These 2 months, we gave you all an overview of the subject. Every single topic, we had a basic discussion. We gave you all a foundation about all those topics. They were detailed discussions, but they all were still all about the basics of those topics. But now on, starting from the 1st of June, when we are launching this program, we shall have brief lectures every day. Of course, live lectures. But the unique part about it is going to be the hyper brief nature of it. What do I mean by that? None of the lectures are going to be more than 30 to 40 minutes in duration. Why so? We understand that as a first year, ना खाने को time मिलता है, ना पीने को time मिलता है, and getting to sleep, everything is just not possible. So to watch those videos, the videos that are 2 hour long, 3 hour long, doesn't make sense, nor is it feasible. प्लस सिर्फ काम करना है बट कुछ इंसाइट नहीं है कि हम क्या काम कर रहे हैं फर्स्ट ईयर में ये इन्वेस्टिगेशन क्यों भेज रहे हैं why am I doing a few things for the patient? Obviously, whatever I'm doing is correct. Whatever I'm doing is absolutely correct. But why am I doing it? That's a question that often clouds the thinking of a first year. So, if that first year is going to be watching these 30 minutes every single day, I can assure you all that the insight into your subject is going to improve vastly. 30 मिनट्स 15 मिनट सुबह देखो 15 मिनट शाम को देखो 15 मिनट दिन के 2 मील के टाइम पे देखो somehow just get those 15 minutes twice a day or maybe 30 minutes at a stretch done. Worst case scenario, you have your emergency duties, you end up missing the lecture, not an issue. Every chapter has been divided by us into 3 to 4 lectures. For example, we have 4 lectures of just anemia in pregnancy, 4 lectures on GDM, 4 lectures on hypertensive disorders in pregnancy. So even if you end up missing one lecture, and if you're going to link up with us the next day, you can still be on track with what we have been teaching. Obviously, the lecture that you have missed would be uploaded on the application. There's no doubt about it. What if you have doubts that you face after you're done watching the video? We have made an exclusive group for all the subscribers on Telegram where we have 24 by 7 live discussions for all the doubts and all the queries. We have already started it 2 days ago and we have been receiving responses on it. All the discussions are going to be evidence based. We are going to be putting all the evidence for whatever doubts that you all face. So it's a 24/7 live conversation, discussions for whatever dilemmas that you face in your ward work or in your practice. What more to these lectures? The next 2 months, June and July, are all going to be about medical and surgical disorders of pregnancy, which includes only an exclusive 2 weeks for infections in pregnancy. Yes, that much in detail. 2 weeks, complete 2 weeks for just infections. For the other weeks, it is going to be medical and surgical disorders, everything in detail. What more? I'm a firm believer of the fact or of the proverb that Jack of all is a master of none. One person cannot be good at everything he or she touches. Hence, we have on board the best of super specialists for those subjects, be it fetal medicine, gynec onco, we have all the super specialists, be it urogynecology, we have a urologist, a urosurgeon on board, be it core obstetrics, everything that you need, we have. So that that particular person who has an excellent insight and experience in practicing that subject is the one who's delivering that lecture to you on that particular day. So that you end up being the best on those topics. What's more that's coming up? ये तो हो गई बात हफ्ते के 5 दिन जो lectures होंगे. What about the weekends? On weekends, we intend to start live Viva sessions, practical discussions with one person every week. We intend to start it with once or twice a month, wherein we shall be allotting all the subscribers a case each a couple of weeks prior so that they prepare and come, and exactly the way you would have your practical exams in your college, they are going to be the same. And we would encourage people from first year and second year, and not just exam going students from third year, to participate in it. It is going to be a thorough discussion with an expert live on Zoom so that you all get multiple attempts to be good at all the topics before your practicals actually arrive. What's more to our application now? Books. Very soon, you all shall be receiving books. We have started working on them, and the first series of books is going to be on all the clinical part of obstetrics and gynecology, including all the practicals. Very soon, we shall be announcing about it. I'm just keeping it under the wraps for now. So, I hope I see you on the other side of this video from 1st of June to join you all for Crisp OG, because I am pretty sure I wish to make every one of you the OG of OG. All the best. Thank you.